When I was helping my dad make his Medicare decision, I was shocked to find the real difference between Medicare Advantage and Medicare Supplement that was never mentioned by the ads, the insurance companies, the brokers, or the agents, or even the government. So in this video, let's talk about the 8 main things to know when comparing Medicare Supplement and Medicare Advantage plans. I'm Emily with the Medicare Coach. We're the leading independent Medicare consultant, helping you navigate all parts of Medicare to protect your healthcare rights as well as your retirement savings. So in this video, let's talk about those 8 things to be aware of when comparing Medicare Supplement and Medicare Advantage. Now, if you've not joined my free workshop, click the link below, save your spot. I go into it in a lot more detail. We'll just kind of quickly dive into this part of Medicare to help you easily, again, make that right decision, but to also avoid the common Medicare mistakes. So, item number 1 when it comes to Medicare Advantage versus Medicare Supplement, and that is no matter which path you go down, you have to enroll in both Medicare Part A and Medicare Part B, as in Bravo. And therefore, when people oftentimes assume that they see the $0 Advantage plans, we can't forget that you're going to still pay for your Medicare Part B premiums. Now, that Part B premium can be lower if you qualify for, say, Medicaid or other low-income help, but it could also be higher if you have a higher income. So, no matter which path you go down, you cannot avoid paying those Medicare Part A and or Medicare Part B premiums. Number 2 thing to be aware of is that Medicare has what's called guarantee issuance rules, which refer to pre-existing conditions. Medicare rules say that when you first join Medicare, Medicare Part B specifically, you have a 6-month window where you can join any Medicare Advantage or Medicare Supplement plan. However, once this 6-month window expires, in order to change Medicare Supplement companies or letters, they're going to ask you for your health history, your pre-existing conditions. And if they don't like what they see, that new Medicare Supplement plan is not required to accept you. This is a very important rule that oftentimes gets overlooked by insurance companies, but it's really important for you to be aware of. This means that when you're deciding which path to go down, that initial decision that you make can have lifelong implications. So we want to be thoughtful around it to, again, have that best healthcare both now as well as in the future. Number 3 is around costs, overall costs, not just those Part B premiums, but overall premiums as well as maximum out-of-pockets. When we look at Medicare Supplement plans, they tend to have higher premiums, but much lower out-of-pocket costs when you start to have medical expenses. But on the other hand, Medicare Advantage tends to have those lower monthly premiums, but can have a much higher cost when it comes to copays as well as out-of-pocket costs. The out-of-pocket costs on Medicare Advantage plans can be over $10,000 a year. So please be thoughtful not to look at just the premiums of the plan, but the overall cost that you pay when you have healthcare. Now, yes, I hope that you're always healthy and never need to see the doctor, but when you do need to see the doctor, it's important to the people that I talk to about protecting their overall retirement savings. So be thoughtful, be aware of how the costs work when it comes to Medicare Supplement as well as Medicare Advantage. People tend to want to be on Medicare Supplement plans when you have health issues, as it is usually less expensive. With that said, though, there is a process to follow that I cover in that free workshop to decide which path ultimately fits you best. Okay? Number 4 thing to consider is the overall billing process as well as rejections of any services. When you're on original Medicare, which is where Medicare Supplement plans come into play, your bills go directly through Medicare. And we tend to see, 1, those bills be paid if it's medically necessary, and they don't usually reject a lot of services. But when it comes to Medicare Advantage, when you join Medicare Advantage, your doctor's bills are now going directly through that private Medicare Advantage company. And they will pay them in most cases, but we tend to see more rejections of bills paid through Medicare Advantage. Now, they used to publish that data, they no longer do publish the Medicare Advantage rejection numbers, but from what we have seen, people tend to have services rejected more on Medicare Advantage than on traditional Medicare, where you have your Medicare supplement plan. There's also articles across the internet that you could find around this topic as well, around rejections or declines when it comes to Medicare Advantage. Now, the next one is around prior authorization. When we're comparing Medicare Advantage versus Medicare supplement plans, Medicare supplement plans in most cases do not require prior authorization. So in that case, you can go to whatever specialist that you want to see without any prior authorization. But when it comes to Medicare Advantage, they tend to require those prior authorizations. So please be thoughtful. If you don't want to deal with prior authorizations, you're probably going to be best on original Medicare with a Medicare supplement plan, okay? The next one is around networks. When it comes to the networks that you can or cannot see for doctors and hospitals, Medicare Advantage versus Medicare supplement are very different. When it comes to Medicare supplement networks, you can see any doctor across the entire country who accepts original Medicare, which is based on studies is about 95% of doctors. However, if you're on a Medicare Advantage plan, whether you pick a PPO or an HMO, there's going to be rules as to which doctors you can or cannot see. In order to get the best coverage for the lowest cost, you're going to want to see your in-network doctors. But again, if you want to see an out-of-network doctor, it can be possible on some plans, but you're likely going to have to pay a lot more for that coverage. So please be aware of how the networks work, and that way you're not surprised in the future, okay? Number 7 is around medications. We tend to find that in certain situations, medications can be cheaper on Medicare Advantage. It's worthwhile to do the full analysis. Generics are usually not a huge difference, but there can be some unique medications that can be costly that could be cheaper on Medicare Advantage. On other cases, though, they can be cheaper on original Medicare with a Medicare Part D drug plan. So my point is this: when it comes to comparing really Medicare Advantage versus original Medicare, where you have a Medicare supplement and a Part D plan, there can be medication drivers that could push you to one plan or the other. And number 8 is extra benefits. When it comes to Medicare Advantage, they tend to have more extra benefits. Extra gym memberships, extra non-medically necessary vision, dental, things like that. There can be extra perks on Medicare Advantage. But with that said, there are certain Medicare supplement companies in some areas that are adding similar perks as well, especially those gym memberships. So be thoughtful on how extra benefits can impact the path that you go down. It's something to consider, but it should not be the main driver of your Medicare decision. So if you found this video helpful, I just covered a lot in a short period of time. I do have a free online workshop that I go through live with you to walk through the steps of Medicare to help you easily do what's right for you. You can click the link below to register for that session where I cover this in more detail. But Medicare can be fantastic when you ultimately do what's right and best for you. So follow along for more inside tips like this video, and I look forward to helping you here at the Medicare Coach when it comes to making your right Medicare decision.